This is my patient. She is 57 years old, and we see some moderate signs of photo-damaged skin with some area more affected by the elastosis, especially periorbital and perioral area. So, first we are going to clean the skin with Fomar 15 and applying it to the skin of the patient with a slight massage, taking care, of course, that nothing runs into the eyes. You always should ask the patient and observe the reaction of the patient, and then leave it for about a minute. And then we can remove the foamer. Either you can use a small towel with the water, or you can use compressors. When the skin is dry, we are going to apply first 15% TCA on the full face. So doing actually one layer but with two sequences, one horizontally and one vertically, to cover the whole skin, starting with the T-zone and then going to the more sensitive areas, the cheeks and the upper lip. And then in a second step, we are going to apply TCA 20%, so rather a medium deep peel to the more photo-damaged areas in the periorbital and perioral area, and also pointed to the lentiginous. Very important when you're doing TCA peel is to observe the reaction of the skin, but also to ask the patient for stinging and burning. Because even with 15%, you can have a severe erythema in a very sensitive skin, and even more important is to observe the skin for the degree of frosting. As the frosting may develop over 1 or 2 minutes, it's very important to wait, maybe even 3 minutes, before applying the next layer, especially in the areas like upper lip or cheeks that are more sensitive than, for example, the forehead. When we look at the nose of the patient, even with 15% TCA, we can see after these 2 layers a slight frosting, and especially also on the upper lip, the development of the frosting over 2 minutes. And then with 20%, of course, more white, confluent frosting, and also in the pointed manner to the lentiginous. There is also very nice white, even coated frosting. And as a last step, what we are going to do, we are going to apply Cosmo Peel cream that is enhancing and prolonging the effect of the TCA peel. We are going to apply first on the whole face, and I always slightly massage it into the skin and make sure that you're really going to the vermilion border, but not too much in, especially if the patients are having a permanent makeup. One thing is very important when you're applying your peel, to go really up to the hairline, also especially in the male patients, to avoid the demarcation line. And another tip, when you have deep wrinkles, either you can stretch the skin and then apply your peel solution, or you can do it directly into the line with the slight pressure, a little bit stretching the skin. This can also be done, of course, on the upper lip.